I am a fitness instructor, and health and wellness is my life. I just always thought that stroke only happened to people who are really unhealthy and really old.
Jessica had one of the more common types of stroke called ischemic stroke, a stroke that occurs as a result of a small blood clot that winds up in a small cerebral blood vessel in the brain, causing a deficit that she experienced.
The day of my stroke was very similar to most other days for me. I taught 2 classes in the morning and felt great, so I took a class myself. Then I went home to shower when all of a sudden a shooting pain went down the left side of my body. And after about 20-30 minutes without the symptoms improving at all, I called my primary care doctor, described to her the symptoms, and she said, you know, I think you should go right to the emergency room.
One of the challenges diagnosing stroke is because it can present with so many different symptoms.
I think there was 2 or 3 neurologists that came and talked to me right away, and they weren't exactly sure. Initially, they thought I might just be having a bad migraine. To be safe, they decided to do an MRI, and I was beyond shocked when they said that, you know, you'd had a stroke.
As soon as we knew that Jessica had a stroke, we really had to work together to put a comprehensive plan of not only early management, but also prevention of a future stroke happening.
I went through 3 or 4 days of testing, and they found that I have a small hole in my heart called a PFO, and their best guess is that a clot went through that hole and went to my brain.
There were several ways to address Jessica's ultimate underlying cause of stroke. One would be to keep her on a blood thinner for the rest of her life. Because Jessica is so young and so physically active, it probably was not the best option for her.
Well, I met with a team of doctors, neurologist, Dr. Roast, a cardiologist, Dr. Palacio, and a hematologist. And they all looked at my stroke from each of their specialties. And then they met together to discuss options for me. And what they determined was that they did recommend a heart surgery to close the hole.
This is not a simple solution. It means that somebody in the prime of their life has to undergo cardiac surgery.
But it really was my choice whether or not to get the surgery. But I felt more confident in making that decision, knowing that 3 amazing doctors looking at my case from 3 different angles, all came up with the same recommendation. So it was kind of like if I was going to do it, this was the perfect time. I was right near an amazing hospital. I had an amazing team of doctors and this great surgeon, which made it easier to feel confident about that choice.
What sets us apart is not only the quality of a specific surgeon. You know, you can have a very talented surgeon at any particular institution. You know, that's an individual skill. But I think it's the system approach that sets us apart.
We see upward of 1,000 patients per year, and we're very proud of our acute stroke program, which is among the very first ones in the country to bring the multidisciplinary approach to acute stroke evaluation. We have emergency physicians, acute stroke neurologists, neuroradiologists, anesthesiologists working together to evaluate patients who come into the hospital.
I see a lot of patients in second opinion from other hospitals in the region and around the country, and when they ask me why they should come to Mass General, my answer is not usually that you should come because you're going to get an operation from me. It's because I think that their overall care in combination with what I do will be the best.
I'm not happy I had the stroke, but it really has changed my life in a lot of ways. One of the biggest ways is learning that so much of disease, 80% of stroke and heart disease, is preventable by your lifestyle. You know, it's really resulted in me wanting to do as much as I can to learn for myself how to prevent a future stroke and to help others prevent future stroke by embracing healthier lifestyles.